Okay, hey everyone, my name is Samantha Hood. I'm going to scan the room first. So, ceiling. Here's our stuff. I'm going to put the phone in position. Make sure y'all can see me. Okay. Alright everyone, my name is Samantha Hood, like I said, and this is my head-to-toe health assessment for FNP1. This is my patient, Marky, and she is going to help me out today. And today is August 28th, 2025. So first we're going to start out our assessment by looking at her skin, looking at the color, temperature, texture, turgor, looking for any edema, bruising, scarring, lesions, or nevi. She's good there. So now we're going to look at the head. We're going to inspect it for size, symmetry, and make sure it's in midline position. We're also going to inspect her and palpate her scalp for hair color, hair texture, hair distribution, any masses, tenderness, deformities, infestations, anything like that. Now we're going to palpate her temporal arteries or any tenderness. She's good there. Now we're going to do lymph nodes and palpate those. So we're going to start with preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. So those are her lymph nodes. Now we're going to palpate for TMJ, looking for any subluxation, crepitus, or tenderness. So I am going to palpate and have her open and close her mouth. Awesome, and move it side to side. Great. Now we're going to do cranial nerve number 5, which is trigeminal. So I'm going to palpate over the masseter muscle and have her clench her jaw. Perfect. We're going to do light touch also while we're here. So I'm going to take my cotton swab and just close your eyes and tell me where you feel it.
Forehead, cheek, nose.
Sweet. So light touch is good. Alright, now we're going to do cranial nerve number 7, which is faces. So I'm going to have you smile, puff your cheeks, puff your lips, and raise your eyebrows. Awesome. It's cranial nerve number 7. We're going to do the ears now. So we're going to inspect the ear for shape and position. We're going to palpate the pinna and tragus for any masses or tenderness. We are going to get our fancy otoscope, and we're going to inspect the auditory canal and tympanic membrane and make sure that her tympanic membrane is pearly gray. So turn this on. Oh, I'm going to pull the pinna up and back too. So up and back. It's pearly gray. Do the same thing on the other side. Up and back. Pearly gray. Awesome. So while we're with the ears, we're going to do cranial nerve number 8, which is vestibular cochlear, to assess her hearing. So first we're going to start with the whisper test. I'm going to be behind her and just repeat after me what I say, okay? 1, 2, 3.
1, 2, 3.
ABC.
ABC.
Perfect. So that is the whisper test. Now we're going to do the Weber test for lateralization. So I'm going to activate my tuning fork and place it on the top of her head and just let me know if you can hear it on both sides.
Yep.
Awesome. Okay. Now we're going to do the Ryan test. So I'm going to activate my tuning fork and place it over the mastoid bone and just tell me when you can't hear it and can't hear it, okay? Can you hear it?
Cool.
What about now?
Yeah.
Awesome. Same thing, other side. Can you hear it?
No.
What about now?
Yeah.
Awesome. Air conduction is greater than bone conduction. Now we're going to move on to the eye. So I'm going to inspect her lashes, any palpable fissures, her brows, everything like that. I'm going to look at her sclera and conjunctiva and make sure that the color is good, no discoloration, no discharge, no lesions, anything like that. We're going to do cranial nerve number 2, which is optic, and that's going to assess gross visual acuity and her peripheral and central vision. So I'm going to take my Snellen chart. For the sake of the video, we're not going to be the 6 feet away, but I'm going to have her, have her cover one eye and read the smallest line.
LTFPH.
Okay, other side.
LTFPH.
Okay, and then both eyes uncovered.
LTFPH.
Awesome. So that is 20/20 vision. Now we're going to, I'm going to have you cover one eye, and then just tell me when you can see my finger, okay?
I see it. I see it.
Perfect. Other eye.
I see it. I see it.
Sweet. Now we're going to do cranial nerve number 3, which is ocular motor, and I'm going to take a light source and we're going to see her direct pupillary response to light. So I'm turn this on. Perfect. And both the pupils constrict evenly. Alright, so now we're going to test for accommodation and convergence. So just follow my finger in. Sweet. That's good. Now we're going to do cranial nerve number 3, 4, and 6. Yes, oculomotor, trochlear, and abducens. So I want you to face me and then follow my fingers to all visual fields, okay? Sweet. That's good. Now I'm going to use my ophthalmoscope. So I'm going to switch over to that. And there we go. We're going to turn it on, and I'm going to assess for red light reflex and be looking at her internal eye structures. So we're going to take the light and then follow it in. Okay? So take the light. Make sure you have take the light. Follow it in. Perfect. Follow it in. Awesome. There is no spots or nicking noted. Now we're going to go to the nose. So I'm going to inspect that her nose is midline and straight. We're going to do cranial nerve number 1, and that is olfactory, which is going to be seeing about smell. So I'm going to have you close your eyes and tell me what you smell. All perfect. Okay. Now we're going to do nasal patency. So cover one nostril and breathe in and out for me. Okay. Perfect. Other side. Awesome. She's good there. And then I'm going to palpate her maxillary and frontal sinuses. The tenderness there. Now I'm going to be looking at her throat and mouth. So I'm going to take my light source again, and I'm going to inspect her tongue, her teeth, her buccal mucosa, her palate, her posterior pharynx, her tonsils, and salivary ducts. See how everything's looking, and her tonsils are 1+, which is good. Then we're going to do cranial nerve number 9 and 10, which is glossopharyngeal and vagus. So I want you to say ah for me. Ah. Perfect. The soft palate and vagus rise symmetrically with phonation. Then I'm going to have you stick your tongue out also. Perfect. This is cranial nerve number 12, which is hypoglossal, and we see that the tongue is midline without gesticulations. Alrighty, now we're going, sorry, Ollie. We're going to look at the trachea, and we're going to palpate it, so make sure it's midline. Awesome. Now I'm going to stand behind her, and we are going to palpate her thyroid gland. So I'm going to gently displace on one side, have her swallow for me, and palpate. Perfect. Do the same thing on the other side. Gently displace, swallow, palpate. Awesome. Now I'm going to palpate the carotid pulses one at a time with the pads of my fingers. Awesome. And then I'm going to take the bell of my stethoscope and listen for any carotid bruits. So, breathe in. Alright, hold it. Okay, breathe out. Okay. Breathe in. Hold it. Breathe out. Awesome. No bruits are noted. Now I'm going to inspect the posterior chest, so we're going to get you to stand up for just a second, and I am going to turn this and just put your back face on that camera, okay? Yeah, we can see you good. Okay, first I'm going to assess for any signs of respiratory distress, tripod positioning, accessory muscle use, nasal flaring, cyanosis, retractions, anything like that. We're going to also inspect for any signs of deformities and make sure they're both symmetric. Then we're going to palpate for symmetrical chest expansion. So I'm going to go below the 7th rib, or at the 7th rib, and palpate. Breathe in. Okay. Breathe out. Awesome. Now we're going to palpate for tactile pharmacist while we're here too. So when you feel my hand, say 99.
99, 99, 99.
Sweet. And then we're also going to percuss over the posterior lung fields while we're here. Awesome. Okay, now we're going to auscultate using the diaphragm of our stethoscope. The right side will have 3 lung spaces, and the left will only have 2. And for the sake of time, we'll be listening for a whole breath, but for now we won't. Okay. Alright. Okay. Egophony. We're going to do egophony. So, every time you feel my stethoscope, say E for me.
Okay. E, 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 E.
same thing, but this is bronchopnea, so every time you put my stethoscope, say 99.
99, 99, 99, 99, 99, 99, 99.
Perfect. And then last, every time you feel my stethoscope, you're gonna whisper 1, 2, 3. This is whisper Victor Logie.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Perfect. Okay. Now I'm gonna have you turn around for me. We're gonna inspect the anterior chest for any deformities, make sure it is symmetric. We're gonna palpate chest expansion, so take a deep breath in and breathe out. Awesome. We're also going to palpate for tactile firmness. So again, every time you feel my hand, say 99.
99, 99, 99, 99.
Sweet. Now we're going to, we're gonna auscultate the anterior lung fields using our diaphragm. Same thing, we would listen for a whole breath. Alright, are good there? Now I'm going to listen to all 5 cardiac areas using the bell of my stethoscope first, and then we're going to do the diaphragm. So we have aortic, pulmonic, herbs, tricuspid, mitral. That was diaphragm first, now we're going to do the bell. Aortic, pulmonic, herbs, tricuspid, mitral. Then we're going to palpate for the PMI, which is going to be near the mitral. So I'm going to go ahead and we would listen for a full minute, but for sake of time we're not, and it should be 70 beats per minute in regular rhythm. So now we're going to lay down. I'm going to move this chair. I'll fix this camera a little bit. Okay, with the patient's head of the bed 30 to 45 degrees, we're going to inspect for any jugular vein distension or jugular pulsation. So we're also going to inspect the chest for any heaves or any lifts. I'm also going to palpate for any thrills over those 5 cardiac points. So make sure you can see, yeah, aortic, pulmonic, herbs, tricuspid, and mitral. And we're also going to auscultate with the patient laying down the 5 cardiac points. So aortic, pulmonic, herbs, tricuspid, and mitral. Okay. Now I'm going to inspect the abdomen for contour, symmetry, make sure it's good there. I'm also going to auscultate for any abdominal bruise with the bell of my stethoscope. So, got the bell, aortic, renal, iliac, and femoral. Sweet. So now we are going to auscultate bowel sounds. So let me do that while we're here. So, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. We're also going to percuss over the bowel quadrants, right upper, left upper, right lower, left lower. And also going to palpate for any masses or tenderness. So palpate, we're good there. Now we're going to palpate for the liver. So I'm placing my hand over the right side, feeling the edge, and having her take a deep breath in. Hold it and then breathe. Alright, I can feel the liver, which is a normal finding. So now we're going to check for the spleen. I'm going to take my hand on the left side, same thing. Take a deep breath and hold it. Breathe. I can't feel the spleen, so that is a normal finding. Okay, now I think we're going to sit back in the chair. Go ahead and have your back facing the camera first, sorry. We're going to palpate for any CVA tenderness. So just tell me if this hurts. Doesn't hurt? Perfect. Alright, now we can face the camera again. Just turn it all the different ways. We're going to move on to musculoskeletal. So I'm going to inspect the joints, the wrists, the elbows, the shoulders, and see any redness, edema, swelling, any deformities, any crepitus, nodules. Make sure they are both symmetric on each side. And then I'm going to palpate the cap refills and the radial pulses, so of each hand. That was cap refill, and now we're doing radial pulses. Like I said, sake of time. Now we're going to do range of motion of the fingers. So follow along with what I'm doing. Make sure they can see me. Okay. So we start it here. Flexion, extension, hyperextension. We're going to do thumb opposition. Okay. And then we're going to do adduction and abduction. Abduction and adduction, so sorry, yes. And then we're going to do the same thing with the wrists. So keep your hands like this. We're going to do flexion, flexion, no, that's fingers. Okay, flexion, extension, hyperextension, radial and ulnar deviation, and then rotation. Yes, get confused. Okay, now elbows, we're gonna do, so they can see me. Flexion, extension, hyperextension, and then for shoulders, we're going to do flexion, extension, hyperextension. Oh, I guess you could stand up a little easier, sorry. Okay, we'll start over for shoulders. Thank you. Yes. Okay, so flexion, extension, hyperextension, internal and external rotation, abduction, adduction, and circumduction. Perfect. Okay, now I'm going to, you can sit right down if you want, it's easier. Oh, stay down, stand up the whole time. We're gonna assess hand strength, so I want you to squeeze my hands for me. Her hand strength is a 5 out of 5 for ARIPS. Now we're gonna do strength of her biceps and triceps. So I want you to come with your arms like this, okay, and then push up. Awesome. Pull down. Cool. 5 out of 5 strength for biceps and triceps. Then for her shoulders, we're gonna push in and pull out. Awesome. That is a 5 out of 5 for abduction and adduction of the shoulders. And then cranial nerve number 11, which is accessory. I'm gonna stand behind her and her shrug her shoulders up against my hands. Perfect. Okay, now we're gonna do cerebral function with rapid alternating movement. So we're gonna do serial finger opposition. Okay, so just follow what I'm doing. I'm just gonna tap your fingers, perfect, and then we're gonna do hand flip flops. Sweet. Okay, and then I want you to touch your nose and then touch my finger. Perfect. Great. You are killing it. Now we're going to have your palms facing up and close your eyes, and we're going to be doing stereogenesis. So I'm going to put 2 objects in your hands, and I want you to tell me what they are, okay?
This is a screw and this is a point.
Awesome, okay? Now keep your eyes closed and your palms facing up, and now we're going to be doing graphesthesia. So I'm going to trace something in her hands, and she's going to tell me what it says. What's that?
A P.
Okay, and then
2.
awesome. Alrighty, moving on. We're going to assess her upper and lower extremities for warmth, color, and make sure there's no edema of upper and lower extremities. We're going to do light touch sensation of upper and lower extremities. I'm sorry, I was in the camera. So I'm going to take my cotton swab and close your eyes and just tell me where you can feel it.
Left hand. Ready. Left foot. Right foot.
Sweet. That is light touch for the upper and lower extremities. Now we're going to do the vibratory sensation of the upper and lower extremities. So I'm going to activate my tuning fork and put it over the proximal ulnar prominence on each side, and she is going to tell me if she can feel that. There we go. Can you feel that? Can you feel that? Alright, and now we're going to do it for the medial malleolus. So just tell me when you can feel it.
Yeah.
Can you feel that?
Yeah.
Okay, sweet. Alright, now we're going to do deep tendon reflexes. So we're going to do triceps. So, I'm going to have her arm like this. That's perfect. Same thing other side. I'm holding her arms, by the way. I don't know if you can see me. Perfect. Alright, now we're going to do patellar. So she's going to have her feet like that. Perfect. Alright, patellar reflexes. Now I'm going to do her Achilles. So I'm going to let her foot hang and I'm going to hold it. Okay, other side. Sweet. Alright, and then Babinski while I'm here. I'm going to just drag it on her foot. I know it tickles. Okay. That's good for deep tendon reflexes. Now I'm going to inspect toes, ankles, hips, knees, and make sure there's any redness, nodules, tenderness, crepitus. Make sure they're symmetric on each side. We're going to do cap refills in her toes, and then I'm also going to assess her posterior tibial and dorsalis pedis pulses. So, do the pulses first, so dorsalis pedis, posterior tibial, and then capri on each. So we're doing that. Now we're gonna do range of motion of her toes. So, we're gonna do just all of my fingers with your toes. So, flexion, extension, hyperextension, adduction, abduction, abduction, adduction, and then, that's it for that. And then ankles, we're gonna do the same thing, follow me with that. So, dorsiflexion, plantar flexion, internal inversion, eversion, and then rotation. Yes. Okay, I'm not even in the frame. Great. Let me do that one more time since I wasn't in the frame.
Okay.
Ankles. So dorsiflexion, plantar flexion. Then we're gonna do inversion and eversion, rotation. Perfect. Sorry, I didn't realize it wasn't in it. Hips. So we're gonna assess the strengths of the hips. So I'm gonna have you push in and pull out. So that's a 5 out of 5 for abduction and adduction of the hips. We're also going to do the strength of the knees. So I'm gonna have you push up, awesome, pull back, yeah. And that's 5 out of 5 strength for the knees, and then same thing for ankles. So go ahead and push up, and then pull back, sweet, or I guess here, pull back, there you go, sweet. 5 out of 5 strength for ankles. Now, we're gonna have her stand up. I'll move this chair for a second. And we are gonna do range of motion of the hips. So, repeat after me.
Okay.
And this is good. So we're gonna do flexion, extension, hyperextension, internal rotation and external rotation, abduction, adduction, and circumduction. Okay, and then knees. Flexion, extension, flexion, extension, hyperextension. Same thing on the other side, flexion, extension, hyperextension. We didn't do the other leg on the hips, so let's do that, the left leg real fast. So, flexion, extension, hyperextension, internal and external rotation. We're gonna do abduction, adduction, circumduction. Sweet. Okay. Now we're gonna look at your spine. So go ahead and turn and move over for me. We're gonna be looking for any scoliosis, and make sure it's symmetric, any just expected curvatures of her spine. While we're here, we're also gonna assess range of motion of her spine. So go ahead and stand up. So repeat after me. We're gonna do flexion, extension, hyperextension, lateral flexion, and then rotation. Sweet. And then cervical spine, range of motion, we're going to do flexion, extension, make sure, flexion, extension, hyperextension, lateral flexion, and then rotation. Sweet. Okay, now we're going to do the Romberg test. So close your eyes, put your hands to your side, and we would normally do this for 30 seconds, but for the sake of time, we're not. So if she swayed, it would be, as long as she doesn't sway, it's a negative Romberg test. So we're good there. Now I'm going to have you walk forward and backwards for me. Awesome. And then do heel-toe walking forward and backwards. Sweet. Now get backwards. Alright, this is tandem gait. And hop on one foot. And then hop on the other. And we're done. Yay!